Impact on Your Health is sponsored by Dennis J. Courtney, M.D., Director of the Courtney Medical Group, located at 3075 Washington Road in McMurray, Pennsylvania. For more information or to make an appointment, call 724-942-3002. That's 724-942-3002 for Dennis J. Courtney, M.D.
Good morning, everybody. Good morning, everybody, and welcome to AM Impact on Your Health. AM Impact on Your Health, where every day our goal is to have you learn at least one thing to help you live better and longer. AM Impact on Your Health, heard each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney, and I'm with you each and every Monday, Wednesday, and Friday from 8 to 9. AM Impact on Your Health, where each day you'll find current medical news, knowledgeable guests, and fascinating health topics, and of course, where we do encourage you to call in to join in. Well, today, folks, it is a Friday, first Friday in the month of August. It is a Get 'em Up, Out of Town version of the show where, of course, we're going to let you come on in and take over the place. Anything on your mind is okay with me. We went through a number of items over the last few weeks to let it have now time to simmer. Boil up a bit, and maybe that pressure is just building up inside where, well, you got to get rid of it, folks. It's going to do you harm. Give us a call and blow off some of that pressure today by letting us share in the venting. The number to do that, of course, is 412-825-6262. That's 412-825-6262. Now, I got a little morsel I want to bring to you today. I'll give you the headline. It sort of sets the tone for the bit of information I'd like to share with you. Here comes the headline, and I love seeing these kind of headlines, and they always get my attention. How about this? Does this get your attention? This is out of the, what's the name? Healthy Living publication. The most important cholesterol reading you're not getting. Boy, that conjures up a whole bunch of images. When I first saw that headline, I immediately grabbed it. Couldn't get enough of reading about it, and of course, want to report it to you today. Of course, you can bring to me anything on your mind. Has nothing to do with cholesterols at all, if you'd like, or if it has to do with cholesterol, that'd be fine too. But I'll kick us off today talking about that most important cholesterol reading you're not getting. It's just letting me know that the medical institutions out there are coming around, but they're way too late. Anyway, more on the subject after we take that first break today. Now, up and coming, hope you enjoyed your time with Dr. Vavavoom, who was with us on Wednesday, talking about her interesting natural remedies. Of course, she'll be coming back, folks. Pretty much, she runs the place around here. She'll be back on the 7th of September, talking about spices, the spices that heal. Then as we move along the month of August, on the 15th, Doug Inglesby will be joining with us. He's been here many times before. Family very deep-rooted in the supplement industry back in those original days when supplements were, well, I mean, they came in the form of one-a-day vitamins and cod liver oil and the like. But his family has been very much entrenched in developing the full line and complement of those nutrients that were the first really well manufactured and distributed multivitamins. Doug will be our guest talking about our low-cal diets driving you crazy. That'll be on Monday the 15th. Then on the 17th, Lonnie Birmingham comes with us. It's the first time she's making an appearance on the show. She wants to talk about heat, the #1 killer of all weather hazards. And we're getting a little bit of a cool-off here in the last couple of days, but things are going to heat up today, and they have been hot around here throughout the entire country. There have been a lot of deaths, by the way. Amazingly, Chicago seems to be one of those places that has more mortal consequences to these heat waves than any other single geographic region. Roland Thomas returns on the 22nd. Roland, of course, is the naturopathic physician, a Canadian naturopathic physician, teams up with a Soviet scientist by the name of Dr. Michael Kiriak. The two of them together now bring a product to you. We're very proud of bringing it to you. by virtue of the fact that they manufacture it. The company is called BioAge. The product, well, F1, F2, and F3. F3 is just the finest supplement I've ever found, a all-in-one supplement where if you're taking multiples of things every morning, if your breakfast nook is a little crowded, if you can't find another spot for another person to sit down at the table because, well, your supplements just seem to be all over the place, I'm going to recommend that you consider making a change, one that will absolutely improve your current status no matter how many vitamins you take in in the morning. I think, by the way, you're taking way too many, and there's a way to bring it and slim it down. We'll talk more about this F3 product with Roland when he's with us on the 22nd. Don't forget, too, MCG testing. We're kicking it off, folks, in the month of August. Now, many of you have done MCG testing. If you don't know what those three letters stand for, it stands for multifunctional cardiogram, a device that we first brought to you back in February through a company called Premier Heart. And Premier is the sole distributor of this device in the western Pennsylvania area. Other parts of the country have picked up on the use of MCG testing. We were just back in February, really in the baby stage. We're probably in the childhood or toddler stage right now. This is just starting to get launched, but you heard it first here, and you'll be hearing it all over the place eventually. A unique way, this MCG testing is a unique way for you to determine what the status of your coronary arteries are without ever subjecting yourself to any invasive procedures. The granddaddy of all procedures, the one that's the gold standard for actually assessing coronary arteries, is a risky little proposition. It's called a coronary catheterization. Now that one sets the blood boiling just a bit. Who in the heck ever wants to get such an invasive procedure? I think it has only rarely ever been asked for by anybody, because usually when you get a cardiac cath, it's because you're in bad way. You've shown up in an emergency room, you've got chest pain, you've got pain in the arm, you've got pain in the jaw, you've got profuse sweating, you've got discomfort. This is the time where an emergency catheterization gets done. And the valuable information that comes from the catheterization, which may lead to ballooning and stent placement, is all too well known by the even most casual listener to this program, and anyone who reads anything in the newspaper understands that invasive cardiology is right around the corner. Quite a few corners. Every hospital has a cath lab anymore. Well, to get that information without subjecting yourself to such an invasive procedure, which has multiple risks associated with it, would be a wonderful and laudable goal, would it not? Well, voila, here comes MCG. MCG testing enables us to get the information about the status of the coronary arteries in as much detail as having a full-blown cardiac catheterization without ever having that catheterization. A wonderful electronic wizardry way of accomplishing this objective that's now available just by lying on a bed with leads placed around each ankle, each wrist, and one on the left side of the chest. This 5-lead approach scans you 5 different times in 6 minutes, 82 seconds apiece, and then sends that data off to be evaluated and compared to a database of 42,000 plus. That number keeps growing, of people who have had the test as well, however, have also had a catheterization, and 166 different data points are able to be assessed by virtue of that electronic passage of current throughout the body, and voila, we get that information and can report back to you what your level of coronary artery disease is. Now, we've done many shows on it. I've just given you a quick 2-minute recap of what this study is. It is now available. It is insurance covered. And there are 2 categories of patients that I'm putting out an invitation for. One Those of you who have already done MCG testing, and by virtue of the scoring of your MCG test, show that you should be repeating the test in either 3 months, or there's another group of patients who have been able to be given a recommendation of repeating it in 6 months. If you are either in the 3-month or 6-month category, you're now up. It's time to do it. Give us a call. 25th of August and the 8th of September are the two dates that are now booked to be able to provide you with that service, and we can find out how well your treatment programs are going to see if you've improved, stayed the same, or actually deteriorated over that time frame. So give us a call here at the office anytime after 9 o'clock today by phoning up, talking to Kim, who's got and taking and providing you with all the slots that are available on those 2 days. 724-942-3002. MCG testing. We're now about to resume, and once we resume at this time, there'll be no gaps because we have procured the device, and we will have it here and available always, and we'll get this stream going, and it's really been helpful to a lot of folks, and I hope you take me up on my invite. You need not have been a previous patient of mine. You just may have the interest, and it's very rare to find in this western Pennsylvania area. Hopefully you'll take me up on it. We'll be bringing Jerry Singleton back a number of times in the near future to discuss it further. And then, of course, we're looking into that month of September as we chip away. The 8th of September, an MCG testing date. The 7th of September, Susan Smith-Jones returns. And then way out into the 16th of September, David Brownstein comes back. It'll be fall. The kids will be back at school. He has some time to spend with us. And we're going to resume our discussion of salting your way to health, which of course is the title of one of the many books that he has written. Keep bringing you unique product lines here at our office. I had another patient come in yesterday talking about her mother, who at the time she was talking to me, actually was in a wound care center trying to have a reparation done on wounds that this woman had developed over the course of the last year. A wound that just would not heal. I've had and run into even a personal situation where a member of my own family had a similar problem. I did not have RTD dressings available to me, and it was really, I'm glad to see that it's now available to you folks. But if you have a wound or a relative that has a wound and it just won't close, they're availing themselves of wound care centers throughout the city. There are now many of them. You may and should probably think about the use of RTD dressings. We carry them here. I believe we're the only facility outside of a hospital that does. I don't really believe you could step up and even purchase RTD dressings at any of the hospitals that carry them because they keep them in the surgical suites in the operating room area, and surgeons are now using RTD dressings at closure time at the end of the surgery. But I can tell you, when looking at the literature, looking at before and after pictures of a whole host of wounds that just were not responding to wound care center style approaches to their correction, have responded with the use of RTD dressings. We carry them. We have them. It's a 4x4 piece of dressing that does a couple of things. Number one, it actually draws the pathogens, draws the microbes from the wound into the dressing itself by sort of a suction osmotic component that no dressing has ever used before. And number two, the dressing itself is impregnated with a vast array, 3 different forms of antimicrobial substances that will kill those pathogens directly through the passage of the pathogen into the dressing itself. RTD dressings available here. If you are diabetic, I can't encourage you enough to have these at your disposal. Keep them in your medicine cabinet, and if you need it, you just cut off a portion of the dressing large enough to cover your wound so that 4-inch by 4-inch dressing can really last quite a long time. Usually wounds are not 4 inches by 4 inches. They're considerably less, and therefore you apply this, you keep it in place for 3 days, discard it, place another dressing on top of the one you just removed, and in this manner work your way to the point where the wound closure occurs and no superseding infection is present. So RTD dressings available here. The back formula, well, we're going to be talking about that on the 22nd, but that is a bioengineered algae concentrate, sort of a one substance fits all, and contains all the vitamins, minerals, enzymes, and fatty acids, you name it. And of course, our most recent offering with all the hubbub and controversy over that phrase that I've used. I'm going to use it again. Here it comes. Are you ready? Fish oils are hazardous to your health. Now, proven scientifically that there is the right way, the correct way to supplement your fatty acids, that it's now in a ratio of 4-to-1 omega-6s to omega-3s. That would be linoleic to alpha-linolenic. The linoleic are the omega-6s, and the parent compound would be sunflower oil. This is a basement compound. This is the starter level that you want to replace and allow the body to maintain and manufacture all the other second and third floor fatty acids that you need from the parent compound. And the omega-3, the alpha-linolenic component, is flaxseed oil at a ratio of 4-to-1, manufactured by one company only. That's called Body Bio. Ed Kane is the president and CEO of the company, and he and his wife Patricia Kane. Well, they've been on our show many times. Ed was nice enough to be with us the last 2 weeks. We'll bring him back, I'll say in the month of September. We'll bring him back and continue our discussion about the use of the role, by the way, that fatty acid corrections play in the reversal of a number, and I do mean a number, of chronic diseases. Oh, final thing I want to mention, I'll still offer it up. There'll be a point where I'll just set it aside, and that is the work done by Yehuda. This 4-to-1 ratio is established by scientific research that has been now duplicated and repeated by a number of other investigators. The original work done in 1994 by a physician, a psychologist actually, psychologist from the country of Israel named Yehuda. And Dr. Yehuda's work is that initial work that first showed that a 4-to-1 ratio of omega-6s to omega-3s, linoleic to alpha-linolenic, is the most appropriate way to correct for fatty acid deficiencies. Now, there are the number of papers written by he, his cohorts, and other investigators. I've got the abstract for all of them. If you would care, if you're scientifically motivated, and you sort of want to make sure that you have covered all scientific bases, and I know many of you listeners do feel that way, send me a self-addressed stamp envelope. We will run off for you and send to you all the abstracts so that you have them for the scientific papers that have been completed, to make certain in your own mind that science is leading the way here. We always hope to be able to say that. I've tried to make certain that science will always be what leads my way, at least, and by virtue of feeling comfortable that science is leading it, I can then report it to you with all the vim, the vigor, the attitude of someone who's feeling very confident about the information it's bringing to you. Science has got to be used, folks, when it's possible to use it, and it's sort of a prerequisite around here to be able to be bringing it to you. All right, let's do this. Let's take a short break. When we return, we have opened it up, as of this moment, opened it up to you. It is a phone-in Friday show, 412-825-6262. Anything on your mind is okay with me, but I'm going to be talking about the cholesterol. Well, let's read it. The most important cholesterol reading you're not getting. Be back in a moment.
This is Dennis J. Courtney, MD. Have you become confused about how best to manage your health? It's no wonder. It seems that every time you turn on the television or radio, another expert has yet another suggestion for you to follow that seems to be reasonable enough, but no matter how dutifully you follow the instructions, it just doesn't quite produce the results that you are looking for. If this confusion sounds familiar to you, give us a call at the Center for Complementary Health, where we'll make some sense of the confusion based on a blending of traditional and alternative medicine that we've been perfecting over the last 7 years. We offer metabolic nutrition testing, immune system repair, natural hormone replacement therapy, chelation therapy, cutting-edge allergy correction, and a host of other safe and effective alternative therapies.
Dennis J. Courtney, MD, is located at 3075 Washington Road in McMurray. Phone 724-942-3002.
Have you been to the doctor lately? Was fatigue top of your complaint list? Even if your doctor asks you what you eat, the recommended 5 servings of fruits and vegetables a day is a dream in your busy schedule. What if you learned of a product 5 years in the formulation that delivers 5 servings of fruits and minerals in just 1 ounce? That's right, it's Fruit of the Spirit. The blessings of Fruit of the Spirit are now formulated into a delicious whole fruit puree product rich in antioxidants and minerals. Your health is more than just a test result. It's a balance of physical, spiritual, and emotional factors. You work regularly to strengthen your faith. Let Fruit of the Spirit help cover your nutritional needs in a convenient and cost-effective ounce a day. Call 1-800-442-3793 for a special promotional offer. Fruit of the Spirit, a blessing for your good health. Fruit of the Spirit, 5 servings of fruits and minerals with no added sugars. That's 1-800-442-3793 for your good health. Call them now, 1-800-442-3793.
Good morning, ladies and gentlemen. Welcome back once again to AM Impact on Your Health. Heard here in KHB 620 each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney with you today on a Friday version of the show. It is a Get 'em Up, Out of Town version of the show where we'd always like you to call in and set the agenda around here if you have a mind to. Anything on your mind is okay with me. The number to do so is 412-825-6262. That's 412-825-6262. We do have a knock on the door. Come on in the store. Hello. Welcome aboard. And what's on your mind?
Hello, Dr. Courtney.
Yes.
How are you, sir?
I'm doing well. How about yourself?
Okay. Listen, would you mind? I have a couple questions for you, okay?
Let's see if we can help you.
The first one, which is, my wife was down yesterday to the heart doctor, and they find out that her arteries in her neck, they're basically, the arteries are about 35 to 40% closed.
Okay.
Now, do you have anything there that she could use and basically would clear some of that out?
By the way, at 35 to 40%, I'd have to say that the doctors that you were seeing weren't too concerned about that. Wouldn't you think that that would be an appropriate way to... They weren't too upset about 35 to 40%, were they?
Well, I guess in their mind, they feel that... in her age, she's around 70, and they feel that because she had open heart surgery here 15 years ago, that they're just sort of living with that. And I'm not really happy with that.
Well, I can see. The reason I made the comment that I did is because I understand the medical community very well. And I think you're talking about Doppler studies of the carotids, where by putting a probe directly over the artery in the neck, they can get and assess the percentage of plaque in those arteries. And I will just tell you that from the medical community perspective, and especially in a 70-year-old, they love 30 to 40%. They expect much more plaque in those arteries. Didn't you get that impression that that's how they felt about the whole thing?
Well, yes, that's true, too. They said it, you can live with that, but we're really actually not happy with that. That way, I'll possibly with some of your stuff.
Oh, hey, I'm going to get to that in just a moment, but what I wanted to do was first say to you, I don't see anybody in the conventional medical community getting upset at all with a 70-year-old female who has 30 to 40% plaque. I'll tell you what, because it's just expected by the conventional community, that you're going to develop plaque and it's going to continue to accrue volume and size over time, that the usual comportance of the medical doctors is that they won't even open their mouth until it hits 50%.
Well, that's what they do, right?
When it hits 50, they say, oh, you got some plaque here. We really should keep an eye on it. And then not open their mouth again until it hits 70%.
Okay.
About that.
That's
And at that time, guess what they'll say? Oh boy, this is mounting up. We should watch this much more closely. But finally, don't say a word until the number 90. At 90%, all of a sudden, oh my God, now we have to do something about it. And the something about it usually comes in the form of a carotid endarterectomy, which at 90% is actually a very appropriate recommendation. Now, let's come back. At 30 and 40%, which in all the cases where I have Doppler studies done, even when they're as low as 10 or 12%, I want that number because I want to be able to reverse the number, which is why you're phoning me today. What to do about it, correct? So I will say to you that although, of course, diet and lifestyle, all those common things that you would think of without ever needing to ask me about them should be in play, I would say that the four-prong approach, the cardiovascular disease that we would use for any place in the body where plaque has accrued, we would put into play for a person such as you described. This is your mother, your wife?
my wife.
Your wife? This is your wife who's 70 years old, and so utilizing all and putting out the fires of all the inflammation risk factors. By the way, on Monday, I've decided that Monday's show is going to be the 10 blood tests, because there are now 10 of them, the 10 blood tests to take to make certain what your cardiovascular inflammation risk factors are. And so, number one on my list, with respect to your wife, is to find out where she stands with all 10 of those risk factors, and then to correct every single one of those. Number two, I got a four-pronger for you. Number two, after that's done, chelation therapy to utilize EDTA, whether that's oral or IV. In this case, probably could still be oral, would be used to help eliminate, diminish, and reduce the amount of plaque. Number three, so as to perfuse the brain with many more blood vessels than it currently has, the use of ECP, which you hopefully would have heard me talk about before in this show. You ever heard me mention ECP before?
Well, I've heard you off and on, and
yeah.
Really thought we paid attention, but once it hits home, you sort of pay better.
All right, well, part three of this is to get into it, involved in an ECP protocol. Not that that particularly changes the amount of plaque, but the idea is to perfuse the organ with such a volume of blood that even with diminished flows, as occurring with 40% plaque and occlusion, the amount of blood that the tissues are receiving is actually enhanced while we're trying to remove the plaque with the chelation therapy. And then finally, putting up a program of dealing with clots, because if you've got 40% plaque, you are developing bleeding around the edge of the plaque, and that bleeding will form a clot, and those clots have to be broken up, and that's where the use of things like nattokinase and beluga come in to be able to do that. Now, there is the treatment plan, just laid out in front of you, real 1, 2, 3, 4 fashion. I would love to spend some time with you and your wife talking about each one of those components in detail and putting a plan into play, which I will tell you. Well, I always think of this one lady. This is very early on in my alternative career. Came to me in a panic because she just had carotid studies done, and her plaque deposition was 95%. Okay?
Whoa, no kidding.
95%. And her doctors, as I said they would, were recommending to her that she should have a surgery. Okay? Well, they were absolutely correct in recommending it, but she wasn't hearing anything of it. She said to me, you got to help me because I do not want the surgery. By the way, that's pretty risky surgery, I got to tell you. Okay?
I would imagine.
So I can appreciate why she felt as she did. But I was early in my career, and I had not done much work with trying to diminish the size of the vinyl plaque. But she said, "Please help me." And I said, "Okay, here's what we're going to do. You're going to do exactly what I tell you for the next 6 weeks. And at the end of that 6 weeks, you're going to go back and get a repeat Doppler study. And if you haven't had, and I mean significant improvement in that amount of carotid plaque, then you have to promise me that you'll go get that carotid endarterectomy. It's the only way I could feel comfortable about spending some time away from that surgery." So she consented, and she did exactly what I told her. In that case, at that time, we didn't have ECT. We didn't nearly know the number of risk factors that we now know, but we did have IV chelation therapy. And so we utilized it. We did it 3 days a week on this lady for 6 weeks, just like she promised she would do. At the end of that 6 weeks, we went back and redid the Doppler studies. And what was 90 to 95% had now dropped to 45%.
Wow.
Now that taught me more. I hugged her and I kissed her and I thanked her because she taught me more than most patients had, and I'm always learning from my patients, but that one back at that time, very early on in the career, was a good omen that's carried me in good stead. Now, it's not just this one woman. I have multiple cases over these years where there has been considerable diminution, decreasing, eliminating plaque. So I will tell you that following the right program, at 30 or 40%, you're in no danger, but as the husband, seeing the other doctors not too worried about it, you are appropriately concerned, and you can act and take charge. Have I answered your question, sir?
Yes, you have on that one. And the other one that I want to ask you, probably a couple months ago, she had what they call a sinus infection. Well, the doctor gave her some medicine that didn't work out. Well, anyway, the sinus infection spread down to her throat and into her lungs. The lungs filled up a part of the water. The blood pressure went up. She had heart palpitations, so we had to go to the hospital.
Sure.
And they gave her stuff that drained the water out. And they claimed because of the infection spreading down there, it took a lot of oxygen out of the blood, and it hurt the heart. Now, they were saying when this is all said and done, that her heart was going to be weak. And we take that Q10 every day, like you mentioned about that. And as far as they took that echo test yesterday, and they're claiming that the left ventricle was poor. Now,
what was the ejection fraction? Do you know? What percent? Did they tell you?
I don't know for sure. I don't know. No, they didn't. So they just said that the heart was weak because of this lack of oxygen, and because of that, and they're claiming that it's like the heart when it pumps. Instead of pumping 100%, it's pumping maybe in different type of pumping, like, a defibrillator. He was talking about putting a pacemaker in there or defibrillator in there.
Oh, boy.
Making that heart up.
Well, you got a whole bunch of, you've opened up a whole can of worms. Let's just quickly say to you that the heart, with age, does lose power, does lose the ability to squeeze effectively. And a measurement of how effectively the heart can squeeze is called an ejection fraction. And so when you got the echocardiogram done, as you did, there was actually a percentage given to you of her ejection. Maybe they didn't specifically spell it out, but you should know it. All of my patients know what their ejection fractions are because we're going to improve them. We're going to make them better. And that's another thing that is just not anticipated to be able to be done in the conventional medical community. So
he did mention one number, doctor. Maybe that was the ejection factor, 37.
All right, that sounds like it is would be the right one to me. Okay, you understand that nobody has an ejection fraction of 100%?
No, right.
Nobody does. They usually start in the range of around the mid-60s, and that's happening in my 30-year and 40-year-old patients. So I just want to give you a certain perspective that the ideal and optimal amounts of squeezing isn't to squeeze 100% of blood out of the left ventricle. It's more in the range of in the mid-60s. And as we age, it's just expected. This is another one of these where the medical community is just anticipating that as you get older, the heart's going to get weaker. Now, we around here say that's baloney. That heart needs to never get any weaker than it is when the day we meet. And we will be able to increase that by using the 4-prong approach I told you about a moment ago that we would be using for the carotid disease that your wife has. That same 4-prong approach can be utilized to improve ejection fraction. So we're always, we've got numbers we flash around to our patients here. They know what the status of their coronary or their carotid arteries are at any given time. Now that we have MCG testing, we know the status of their coronaries, and with respect to ejection fraction, every single patient that I manage knows what their ejection fractions were, and they know what they are now, and the vast majority of them have tremendous improvement in those ejection fractions. I hope I've made my case. Get on in here. Please come on in and let's talk.
We will, because originally, before the sinus infection, her ejection factor was 50.
Yeah.
After the sinus infection, could this sinus infection have brought this on, the weakness of the heart?
Well, it appears what happened here was you had a pneumonia. Literally, you collected fluid from this infection that you could not oxygenate the blood properly, and the heart had to work harder to try to oxygenate as much blood as it could to get it around the system. In that attempt to maintain a level of oxygen in your blood, the heart just got exhausted and developed a substantial loss in its ability to squeeze in a very short period of time. Usually it takes something like a heart attack or something of that drastic nature to get such a decrease. It got a 50 to 37% in a short period of time. Says really to me that there was an event. There was an event, and that the new number of 37 is the new number, and they're going to be content with not allowing it to go. Well, they just expect it to go lower. I'm saying to you, we need to get that back to 50%, and I will show you a way to accomplish that. All right?
Okay, so they want to put this. What's the difference between a pacemaker and what is it? What's the other one they use?
You said defibrillator.
Is there a difference between those?
Oh, it's a big difference. The pacemaker. The pacemaker is used only if the heart beats at such a low rate that you become in potential peril. The normal level anything under 60 beats per minute is you move into the questionable area. As you move into the 50s and lower, then it's no longer questionable. You put a pacemaker in that will not allow the heart rate to go below whatever you set it at. So if you set it at 60, the pacemaker comes in and keeps the heart rate always above 60. If you set it at 55, it will do the same.
When they checked her blood pressure, she was 123 over 56 over 60.
Yeah, well, that blood pressure itself wasn't all. There wasn't anything completely abnormal about that. That actually was pretty good. I wouldn't be worried about the blood pressure. Okay?
We have a regular blood checker here, and we probably check it 2 or 3 times, 4 times a week, and at any given time, the most it ever goes down is maybe 57, but averages around 60, 62 all the time.
Yeah, that's her diastolic, and there's certainly no problem with it. It doesn't appear like your blood pressure is the issue. It appears like plaque as well as heart weakness called congestive heart failure is. Let's say, come on in to see us, and we'll then take this from a general discussion, which everybody's benefited from, and bring it down to the specific recommendations for your wife, okay? Okay, sir? Oh, we already lost? All right. Another knock on the door. Come on in the store. Hello, and welcome aboard. What's on your mind?
Yes, Dr. Courtney. I think it was last Friday that you were talking about Lavazza.
Yeah, sure was.
Lower my triglycerides. And my doctor has me on that, but then I stopped taking it because, it caused soreness in my chest. I don't know if you call it chest pains or just muscle soreness. And I went to him and I told him about that because it lowered it like 100 points.
Lowered what 100 points? It lowered what? Your cholesterol?
Triglycerides.
Your triglycerides 100 points, okay.
About in 6 months. And he said, well, don't worry about it. If it's a little bit of chest pain, or not chest pain, but soreness, ain't going to hurt anybody, But I was wondering, what is the real truth on that?
Well, what you heard me say last Friday, and probably for a few Fridays in a row now, is that we now know the safest and most efficient way for you to replace fatty acids. Lavazza is the pharmaceutical world's entrance into the supplement realm. That's their answer to how you should replace your fatty acids. Now, uniquely, for a pharmaceutical company to put a product together that they expect to get a patent on, they can't give you anything that's just natural. So they may have wanted to use fish oils in the past to do that, but they can't because they can't get a patent on it. So they have a reesterified form of these of fish oils, and then they put other ingredients in it, which makes Lavazza a completely unnatural molecule. This does not exist in nature. It was manufactured by the pharmaceutical company, and anytime you have an unnatural and man-made molecule, you usually have a problem. So I said last Friday, and I've been saying for a couple of Fridays, and I'll be saying for a number of Fridays into the future, that things like Lavazza and, of all things, fish oils are hazardous to your health. And the way that you have to replace your fatty acids now should be with oils that have a ratio of omega-6s to omega-3s of 4:1, and the omega-6s should be sunflower oil, and the omega-3 should be flaxseed oil, and that combination is the safest way for you to build up your fatty acids, okay? And I would say Lavazza, as most other pharmaceutical preparations, being unnatural molecules made by medical science, there's the problem. It does not exist in nature. They formulated it in order to get the patent, and to get that patent and to use that formulation brings the element of risk to the product. Fish oil, as natural as it is, also has its own risk. I say now, replace essential fatty acids in a 4:1 fashion, utilizing 4:1 oil. Okay?
So the best thing is not to take that?
Well, you want to replace your fatty acids. You just don't want to be using these pharmaceutical preparations, in my opinion, especially when it's now known that these natural substances are what's scientifically in your best medical interest. It's now known that you should have a ratio of 4:1 omega-6s to omega-3s, and utilizing linoleic to alpha-linolenic, sunflower to flax. This scientific information has now withstood the test of scientific scrutiny for 16 years. You got to go with it at that point. And Lavazza has been out for 3.
See, at first you put me on Lopid to try to lower my triglycerides.
Triglycerides, absolutely. I understand what the Lopid was for. By the way, there are much better ways to reduce triglycerides with natural approaches, and that is through the use of correct supplementation, as we're talking about today. These fats that we're talking about will absolutely do that. Niacin, gugu lipid, red rice yeast, these are all ways to lower their triglyceride by natural forms and not using a pharmaceutical product. So come on in and see us, schedule an appointment. We will talk about your case specifically in so much more terms than just the 2 you've mentioned, because it's my guess that you have many more cardiovascular related issues other than the 2 you just mentioned. Okay?
Yeah. All right.
Come on in.
Okay, thank you.
Okay, absolutely. There you have it. All right. Now, 412-825-6262 is that number. Let me get to the point I wanted to get to today when I opened up the show by talking about this byline, and it comes out of Healthy Living. Dr. Aniston, okay, a medical doctor, wrote this article, and it's entitled "The Most Important Cholesterol Reading You're Not Getting." Let me read a little bit. It's just a short thing, but I think many things can be learned from the short little paragraph that the doctor wrote about. He says, there's a paradox that's long puzzled doctors. Roughly half the people who have heart attacks have perfectly normal cholesterol levels. By the way, I had never seen that number before. And if that's accurate, that's astonishing, isn't it? Roughly half the people who have had heart attacks have perfectly normal cholesterol levels. I had a patient once who had just a cholesterol level of 145, well below the 200 threshold above which doctors recommend treatment. And yet he had suffered 2 heart attacks by the age of 48. Another patient had a cholesterol of above 300, but had never had heart attacks and had no plaque in her coronary arteries at all, because they actually did a cardiac catheterization on this woman. Now, doctors now have at least a partial explanation. While we've all been obsessed with our total cholesterol numbers, it turns out that the size of those cholesterol parts are important. Excess LDL, or bad cholesterol, ends up getting deposited in arterial walls, and forms plaque, which causes arteries to stiffen and blood pressure to increase. But not all LDL particles are equal and likely do equal damage. If they are very small, if these LDL particles are very small, they do create problems, and they are like little darts that easily pierce the arterial lining and deposit within the walls of the artery themselves. Now, what they're finally getting to, and they're finally talking about, is LDL particle size. We had brought that concept to you a number of months ago, probably over a year ago now. We've been testing for LDL particle size, and this is more or less proving the point that the cholesterol era and how it was handled by the conventional medical community, it is and was a complete failure. Everybody got hopped up out there over your cholesterol number, and they got into an unholy relationship with the pharmaceutical industry. We got statins as the child and the offspring of that relationship, and we've had it rammed down our throats ever since, trying to lower our cholesterol level, now well beyond the level of 200 and easily entering areas of 130 and 140, which are really dangerous. Well, now they're mentioning that the real component was the LDL to begin with, and not just any old LDL. The particle size most potentially harmful is the LDL small particle size. There are 5 different sizes. The small ones are the most injurious, and this gentleman finally come to the realization that it probably answers the question why someone with 145 cholesterol can have so many heart attacks, and somebody with a 300 cholesterol doesn't have to have any. This is the real message to be learned from this article. I'll talk more about it on Monday. I'm going to, by the way, on Monday talk about the 10 lab tests. LDL particle size will be one of them, but I'll go through and run through that list as I do about once a year. It's now time to bring a list, because the list used to be 8, and now it's 10. Hey, we got a knock on the door. Come on in the store. Hello, and welcome aboard. What's on your mind?
Yeah, hi, Dr. Courtney.
Sure. How are you doing?
How are you?
Uh-huh.
Good. Hey, I have a question. I'm not sure if you're familiar with the product I'm interested in.
Let's see.
The product is called Go Away Gray.
Go Away Gray. Oh, no, I'm not familiar with it, so why don't you tell us about it?
Well, supposedly it's for keep away gray hair, of course, and they said if you have hypothyroidism, that you were supposed to check with your doctor first
Okay.
to see if you can take it, but my question is...
Is it a pharmaceutical preparation?
You know what? No. It's over the counter, but I see like some nutrients in it, some vitamins like biotin, folic acid, soft palmetto, horse-tail extract, and I think the main ingredient was the L-tyrosine. Would that be why maybe it's contraindicated to take it, because of your non-thyroid medication? Would that be the thing?
Well, let me just say that one of the questions that we ask we're assessing thyroids all the time around here. With respect to hair, there are 2 questions that keep coming up. First one is, do you have unusual hair loss? By the way, do you? Do you?
Yeah, I have a diagnosis of hypothyroid, and I am on Armour Thyroid.
Okay. Well, in your workup, your hair loss issue would have been important to the doctor who initially worked you up. And then the second question is, has your hair prematurely grayed? Okay. Now these are commonly found in people with thyroid disease. So if you have premature graying of your hair, the fact that you've been diagnosed as a thyroid patient actually matches up quite nicely. Now I'm unfamiliar with the use of the substances that you've just talked about in trying to, if I get the idea behind it, trying to remove, lessen, diminish the amount of gray hair. Isn't that the reason that the product was made?
Yeah.
Okay.
People do say it works. That's why,
Okay, well, I'm unfamiliar with it, and I think that the issue of your thyroid actually has more scientific validity in my own thinking than all those. Now, the tyrosine is used in dopamine synthesis, and so to the extent that dopamine does play a role in that type of metabolism, at least I'm comfortable with that particular part of your supplement. You said tyrosine was one of the components, but yet I've never heard that these agents in this combination have ever been suggested to be able to reverse gray hair. So I'm not going to be able to help you out there. Maybe somebody out there listening can, but I'm not familiar with the product.
Yeah, I'm just wondering which ingredients, for them to say that when it was on the news when this came out, maybe it's been about a year now, but I'm just wondering which ingredients. I don't know why they would say that. I'm just wondering which ingredient would probably interfere with the Armour Thyroid, or if that's fact, or why it's even related, why you couldn't take it if you had hyperthyroid. But do you think if I talked to a pharmacist, they would know more?
Well, you certainly can talk to a pharmacist. The way I would put that together is, if you have thyroid disease and you're taking a product of this type, it's your thyroid disease would have to be corrected in order to allow you to reestablish normal hair color. And if you're going to be taking a product to try to change it, even though these products are over the counter and they really by themselves aren't that problematic, they don't hold that much risk, of any risk at all in taking them, it would be that you couldn't expect to improve a graying situation in a patient who was hypothyroid. You're seemingly corrected with your thyroid problem because you've been on Armour Thyroid hopefully for quite a while, correct?
Right.
So you're corrected. You wouldn't have to be a person who would have to avoid that because your thyroid issues are corrected by your daily dose of thyroid hormone. It would be the problem in an individual who is taking what you would like to be taking now, who didn't have their thyroid disease corrected. It's the thyroid disease that has the relationship to the premature graying, and if you're going to be taking a product to try to restore the old color, it will not be restorable as long as your thyroid disease is allowed to run rampant. I hope I make some sense.
Alrighty. Okay, I just thought I'd give it a shot and see if you knew anything.
Not familiar with that product, but I understand why the precaution is should be taken with doctor recommendation if you have thyroid issues, however it was said on the label. Okay?
Okay, thanks for your help.
Absolutely. Bye-bye. Yeah. Graying, premature graying. And there's a product now that Go figure. Another knock on the door. Come on in the store. Hello, welcome aboard. What's on your mind?
Dr. Courtney?
Oh, yes.
Yes, sir. I wanted to order that 4-to-1 ratio in that fatty acid. I was talking to you a few minutes ago. My battery in the phone went dead.
Give us a call. The product is called 4-to-1 oil.
Yes,
it's
sir.
made by Body Bio. We probably are the sole distributor of it at this point in the Pittsburgh area. Give us a call. We can't keep the stuff in it. It just keeps it flying off the shelves. But we got our last order last week. The number here is 724-942-3002. We'll send it out.
I'm definitely going to get a hold of you next week, but in the meantime, I have to go back to see the doctor. I had mentioned to you about that injection factor 37.
That's right.
Anything that you can recommend as far as pills or supplements or something that we can take to strengthen that heart?
Yeah, I would say you're already taking CoQ10, but unfortunately, I'm not a big fan of CoQ10 because it's the most expensive supplement that there is, and it is. It's the most costly of all. and you only absorb a very small percent of it. So it's all wasted. Whatever you take in by mouth ends up going out of the body in the next bowel movement. It just doesn't absorb it. So there's a substitute for the CoQ10 that makes more economic sense. It's called idebenone, and called idebenone. CoQ10 is generically referred to as ubiquinone, and one methyl group away is the sister product called idebenone. It has as much and can easily substitute for ubiquinone, but it's completely absorbable. And so the idea behind shunning the CoQ10 is not that the CoQ10 isn't a wonderful substance, but you can't assimilate it. So if you can't assimilate it, why in the heck would you be taking it? Okay?
So would that help that injection factor from 37 to come up?
Yeah, you need to have the right fuel and the right spark. The right spark is the CoQ10. It's sort of like an engine of a car. You need a spark and you need fuel. And the fuel needs to be D-ribose. And it is now available, has been available for a number of years through a company called Corvalin. Corvalin makes a product. The product is called Corvalin, I believe. Anyway, the D-ribose is in a product in our office called ATP Option, where they mix the D-ribose, which is the sugar that the heart prefers, with idebenone all in one product. That product is made by Sir Arnold Takimoto. The company's called Bioimmune, and we do carry it. It's called ATP Option, okay?
Now, what we're going to do, we're going to go see the doctor next week as far as this, he wants to talk about putting his pacemaker in. I would like to stall him off and more or less get in touch with you.
Well, heart rates are one thing. I mean, you only put pacemakers in if the heart rate has the potential of getting very low.
So
so
what do you consider low, doctor?
Well, anything below 60. Anything below 60, okay?
Anything below 60.
Yep.
Stay.
Pardon me? All right, look. Enough said on this subject for today. On Monday, I'll go over those 10 lab tests to assess your cardiovascular inflammation, because there are 10 now. Remember, the list used to be 8. I'll go over all 10. You be ready to write on Monday morning. We'll come back to it. Until then, I want you to have all a wonderful weekend. It's going to get hot around here, folks. See you on Monday. So long.